Good morning, Arkansas. We are happy to have Dr. Loretta Depalo. She's the medical director of the Wound Care Center with the Arkansas Heart Hospital. And today we're going to talk about really what does the Wound Care Center do. Good to see you.
Thank you.
Good to have you here. I think a lot of us don't think about this part of medicine, but let's talk about the center and really why you're there.
It's a specialty that's been around for about 20 years or so. The Heart Hospital's had a wound center for approximately 15 years. And it's a comprehensive center that treats chronic wounds or very complex wounds, wounds that primary care doctors pretty much refer to us, or patients actually can refer themselves to us if they choose. And we see just a variety of wounds: diabetic wounds, wounds from bone infections that won't heal.
Right.
We have 3 hyperbaric chambers, and we use the hyperbaric chambers for the most complex of wounds. We could also use it for carbon monoxide poisonings and various other things, but mostly for our wounds.
Okay.
We have very advanced treatment modalities. We can use wound vacs, we can do skin grafts, and it's a very comprehensive evaluation of the patient initially when they come in. And so if there are other factors involved in their wounds not healing, then certainly we can get them referred to the physicians to help fix that issue, and then we treat the wound along with that physician.
We've got a list of some of the conditions that would bring somebody to you on the screen there. So some of these are heart-related, like diabetes, but others are not, right? It's not necessarily a heart-related condition.
Exactly. We see a lot of orthopedic wounds that don't heal, amputations that don't heal. So yeah, it's just a very wide spectrum of different kinds of complex wounds, even burns and whatnot.
Yeah.
So.
Are some people just conditioned where their wounds don't heal as well as, say, someone else's do?
Oh, sure. Everybody's different, and the treatments that we generate for the patients all tailored to the particular patient. And it might change week to week. We see our patients, just general wound care patients, usually once a week, and it's just Dr. Furtado and myself that work there, and we work pretty closely together, and every time we see the patient, we come up with, a different modality, just to try and enhance the wound healing and try and get things going for the patient.
Of course, being the Heart Hospital, surgery is going on there every day. Are you sometimes called in when there's a surgery happening and they know this may be a problem?
Well, yeah, they'll consult us. So we have an inpatient nurse at the Heart Hospital. Once the patient is discharged from the hospital, they'll follow up in the clinic with us. So it's pretty contiguous care for them. All
within the same building, really, where you can get this taken care of.
Yeah.
You mentioned the hyperbaric chamber. That sounds very sci-fi, like in the movies. Tell us what that's like if you are going to one of those.
We've got 3 hyperbaric chambers, and they're the largest monoplace chambers. That means for one patient. And the patient goes into the chamber. They can watch TV, they can fall asleep. It's pretty low-key. They can move around in the chamber. It's a very big chamber. And what it does is it puts, in layman's terms, it puts oxygen into the tissues that normally wouldn't be getting oxygen from just their vascular status or their vessels or their arteries. So it helps enhance wound healing. It helps form new blood vessels in the tissues, especially diabetics that have bad circulation and that kind of issue. Most of their wounds are on their feet or on their legs. And it really helps as far as keeping people from getting amputations. It helps us heal the wounds along with our usual treatment modalities.
Well, knowing that you can move around, you're not in a small capsule, that would probably make a lot of people more comfortable.
Yeah, and they can watch TV, and they can bring DVDs if they want. So yeah, it's a pretty comfortable environment for them.
Very good. If someone is interested or thinks maybe they need to be checked out by you guys, what's the easiest way to do that?
They can just call and make an appointment at 219-7900 if they need a referral, or if they have to have some type of approval by their insurance. We have people that can help them work through that, but most patients can be self-referred.
Come in and get an assessment. And how long would you say do you go on with a wound before you should contact someone like you? What's the normal time?
Usually it varies, but if there's a wound there for more than 2 or 3 weeks that's not healing, definitely call us.
Yeah, absolutely.
Call
The
us.
sooner the better, probably,
Exactly.
to get on it so
Exactly.
that you can do your work then. Let's put up the information about the Wound Care Center. They're, of course, at Arkansas Heart Hospital, all part of the same hospital, and they can certainly help you out and give them a call. You can also go visit their website as well. You'll meet with Dr. Depalo or Dr. Furtado as
Exactly.
well there. Thank you so much,
Thank
Dr.
you.
Loretta. Thanks
Thank
for
you.
being here.
Appreciate it.
All right, back in just a little bit with